So when I started doing my MBBS, in the first year, we just do the basic subjects of anatomy, physiology, and biochemistry. By then, I was not sure what I wanted to do after MBBS, not yet. But in second year, when we actually start our ward rounds, when we go into the hospital wards, when we start seeing patients, when the theory turns into practical, is when I got so drawn into the field of obstetrics and gynecology. It was very clear in my head that once I finish MBBS, it's obstetrics and gynecology or then nothing. I didn't want to be any other kind of a doctor. That's how focused I was. I would have even changed my field and done something else, but not continued as a doctor in a different field. So then comes my MD. I finished that. And in 2004, after finishing my MD, when I wanted to start exploring what to do further, I had my mentor, Dr. Gautam Alabadia. In 2004, there were a handful of clinics that were providing fertility services, and his was one. I met him because I wanted to get a little bit of an exposure about this. Back then, during our residency in MD, we were not taught much about infertility. It wasn't yet such a big subject, but he had started his own IVF center. I met him. I thought, let me work with him for a while and see how I feel about this. I started working with him in 2004, and then there has been no looking back. Because only once I started working, I realized that this is one field where, science, technology, and compassion are so beautifully interwoven with each other. In very few other fields do you get a chance to make such a huge difference to somebody's life.
Yeah.
You're walking through a very important journey with them. You see them when they come to you absolutely desolate and stressed. And when you've been a small part in helping them achieve a dream, the transformation, when you see a family complete, when you see them welcoming their baby, the little giggles when they bring their babies back, it's a completely different person who's coming to meet you. So there is such a huge impact, and there's such a huge impact of the human element in this field. So I do believe that as doctors, we have the privilege of working in a field where we can make that difference to people's lives, where it's not just business, it's about the human element. And I loved it, so I decided to continue doing that. In 2004, it was considered a bit of a risk to continue with only infertility and give up your obstetric practice. But my mentor did advise me that the future is going to be the era of super specialization. So if you've liked a field, it makes sense to continue with that. And so then I did continue with it. Initially, that's how I started. Then, when I got married in 2011 and I wanted to start a family of my own, I was suffering from severe endometriosis, which I knew as a teenager because I'd been operated for endometriosis at the age of 19 as well. But after I got married and 6 months went by and I hadn't yet conceived, I got all my investigations done, and the situation turned out to be way too complicated for it to allow a natural conception. I had to undergo a very long surgery, which lasted 4.5 hours. And after that, it was very clear that there was no way other than IVF. So that was the time when I turned from not just being an IVF specialist, but to being an IVF patient.
Wow.
And that really changed the way I practice this field of medicine now. Because when I'm sitting in front of a patient, I know what she's thinking, I know what she's going through. I've been on both sides of the table. Only once I went through it, I realized how exhausting this journey can be. The hope when you're starting a new cycle, the anxiety when you're waiting for the pregnancy test report to come, the heartbreak if it comes out negative, the devastation if it comes out positive, and then there is a miscarriage, and the courage it takes to say, I'm going to try again. I've walked down that path. So now, when I'm treating somebody, I'm not just treating somebody as a doctor who specializes in this, but as a woman who's been through the same struggle. So I know how she's feeling, I know how the couple feels. I ensure that because of what I've gone through, and we always feel that if your struggles have taught you something, then your struggles have been worth it. My IVFs may not have led to the outcome I wanted, but If they taught me to be a better doctor, a better listener, a better human being, then those struggles were worth it.